You know, the anal canal is a muscular tube and it has got powerful anal sphincters. The anal sphincters are divided into two: internal anal sphincter and external anal sphincter. Okay, these are the external anal sphincter, and here comes the internal anal sphincter. You know, internal anal sphincter are the continuation of circular muscle coat of the rectum. You know, rectum has got circular muscle and longitudinal muscle. So the circular muscle of the rectum continues downwards and forms the internal anal sphincter. Internal anal sphincter. And you know, internal anal sphincters are smooth muscle fibers. Smooth muscle fibers. They are involuntary and they are pain insensitive. Insensitive. They are not sensitive to pain. Remember, that is the internal anal sphincter. And this internal anal sphincter does not extend throughout the length of the anal canal. It covers the upper 3/4 of the anal canal. You can see the lower part, there is no internal anal sphincter. Okay, so remember, the internal anal sphincter covers only the upper 3/4 of the anal canal and extends up to this Hilton's line. You know the white line of Hilton over here. So the internal anal sphincter extends up to this white line of Hilton. Now, let us see the external anal sphincters. External anal sphincter is divided into three: subcutaneous part, superficial part and deep part. Okay, and unlike this internal sphincter, external sphincters are skeletal muscle fibers formed by skeletal muscle fibers. They are voluntary and they are sensitive to pain. Sensitive to pain. Sensitive pain. So here in this diagram you are seeing the different parts of external anal sphincter. So here we have the subcutaneous part, then comes the superficial, and this is the deeper part. Okay, superficial and deeper part. You can see this is the deeper part. The deeper part is annular in shape and surrounds the anorectal junction. So this is the rectum and this is the anal canal. So this deeper part is present at the anorectal junction. Anorectal junction, and it does not have any bony attachment. Remember, it does not have any bony attachment, and it is closely related to these fibers of puborectalis. This muscle is the puborectalis muscles. Deep part of the external anal sphincter is closely related to these fibers of puborectalis. Puborectalis. Just below that we have the superficial part. Superficial part, you can see it is elliptical in shape. This shape is elliptical in shape and it arises from the tip of the coccyx. Here we have the coccyx. It rises from the tip of the coccyx and the anococcygeal raphe posteriorly. It surrounds the lower part of the internal anal sphincter and it is inserted anteriorly to the perineal body. Anteriorly inserted to the perineal body. And below we have the subcutaneous part here, and the subcutaneous part, it's a flattened band around the anus. It lies below this superficial part and it also does not have any bony attachment. Now, what are the recent concepts of this anal sphincter? Okay, as per the recent concepts, the external anal sphincter or the anal sphincter does not have three parts. It has got only a lower part and deep part. Okay, and this upper part is attached to this anococcygeal ligament posteriorly and anterior to the perineal body. Uppermost fibers are blended with the puborectalis muscle. And the lower fibers of the external anal sphincters lies inferior to the internal anal sphincter and is traversed by the fibers of conjoined longitudinal muscle coat. Now let us see this diagram. So here again you can see internal anal sphincter, then we have external anal sphincters. Okay, here you can see in between the external sphincter and internal sphincter there is a fibroelastic structure is there. That is known as a conjoined longitudinal muscle cord. Conjoined longitudinal muscle cord. What do you mean by this conjoined longitudinal muscle cord. It is formed by the, what exactly is, we have the circular muscle cord of the muscle of the rectum. Outside we have the longitudinal muscle cord of the rectum. The longitudinal muscle cord of the rectum runs downwards, lies or enters in between the internal sphincter and external sphincter, continues as the conjoined longitudinal muscle cord. Conjoined longitudinal muscle cord. Okay, this conjoined longitudinal muscle cord, on reaching the level of Hilton's line, it divides into several septa. One septa goes medially towards the Hilton's line. Hilton's line. Okay, and the lateral one which runs laterally, and the one which is going laterally is known as the perianal fascia, and the one which goes medially, that is known as a intermuscular septum. Intermuscular septum. And this intermuscular septum, where you can see it is separating this internal sphincter from the subcutaneous part of the external sphincter. Subcutaneous part of the external sphincter. Then what happens to this lower end of the fibroelastic septum? This fibroelastic septum again divides into so many fibers. It passes through the subcutaneous part of the external sphincter and divides the subcutaneous part of the external sphincter into different compartments. Okay, so this compartmentalization leads to the corrugated appearance of anal skin. Corrugated appearance of the anal skin. That is because of this particular fibroseptum, and that muscular fibers are known as the corrugator cutis ani. Corrugator cutis ani. Now, so here we have the perianal fascia, and the space below the perianal fascia is known as the perianal space. Perianal space. Now, one important point. You know, normally anatomically, here we have the internal sphincter and this is the external sphincter. Okay, internal sphincter lies above the external sphincter. Okay, and under anesthesia, or when the anus is stretched, the lower end of the internal anal sphincter lies lower than the external anal sphincter. Very important point. Remember this one. Normally, anatomically, the external anal sphincter lies lower than the internal sphincter. Okay, under anesthesia or when the anus is stretched, this internal anal sphincter lies below the external anal sphincter. Lies below the external anal sphincter, and again, the internal anal sphincter can be distinguished from the external sphincter by its color. The internal anal sphincter is light in color. That is just like the color of a chicken meat. Again, this internal anal sphincter is divided in sphincterectomy for anal fissure and exposed during hemorrhoidectomy. Okay, surgical procedure related to the anal fissure and the hemorrhoids. This internal sphincter is divided. Okay, how we can identify or distinguish the internal sphincter? Under anesthesia, this internal anal sphincter lies lower level than the external sphincter, or it is different in its color. That is, it is light in color. Now, let us see what do you mean by intersphincteric plane. You know, we have the internal anal sphincter, here we have external anal sphincter, and there is a space between these two. That is known as a intersphincteric plane. Intersphincteric plane. So, intersphincteric plane is a plane between the external sphincter and internal sphincter. Okay, remember, this plane can be opened up surgically to provide access for the operation of sphincter muscles during sphincterectomy. Okay, so this intersphincteric plane is used to insert or the instrument. That means this intersphincteric plane can be opened up surgically to provide access for operations on the intersphincteric muscles. Advantage is this intersphincteric plane is not crossing any blood vessel or nerves. Okay, no blood vessels or nerves are crossing through this plane. Only some anal glands are passing and opens into these particular anal sinuses. No blood vessel and nerves are passing through because of this one. So this intersphincteric plane is used as a plane to provide access for the sphincterectomy.